As part of Mandela Month celebrations, volunteer surgical teams of Project Flamingo performed 35 surgeries in a single day on breast cancer patients in the public healthcare sector. Their aim was 30, making this an unprecedented attempt in South Africa. Project Flamingo is a breast cancer NGO that performs surgeries on public health sector patients in the Eastern Cape and in the Western Cape. Breast cancer is the most common cancer in the world and the most diagnosed among women in South Africa. In the public health sector, long waiting periods and a lack of infrastructure result in the unnecessary loss of life. Project Flamingo's Knights in White coats hope to bolster access to expert cancer treatment for all. And for more on this initiative, we're now joined by founder of Project Flamingo, Dr. Liana Roodt, and she joins us now via our video link. Dr. Liana, thank you so much for your time this evening here in SABC News. Maybe let's start off here and tell us more about your NGO. What would you say and how did you say it came about? What made you start Project Flamingo?
Well, thank you so much for having us, and most importantly, thank you for telling the story of our patients. Project Flamingo was born in 2010, so we've been going for 14 years, and really what prompted the birth of Project Flamingo was witnessing the suffering and the anguish that goes along with patients dependent on the public healthcare sector, waiting for life, saving really cancer surgeries and cancer treatment, and myself and a bunch of my friends and a bunch of my colleagues just being unable to tolerate witnessing this. So hence the birth of this NGO, striving to try and make possible more timely and more holistic breast cancer treatment for patients dependent on the public healthcare sector.
I mean, you've been spearheading this initiative for the past 14 years. How many people would you say have been able to benefit from this NGO?
Somebody's, in terms of actual surgeries, we have done more than 1,500 surgeries, actually approaching 1,600 surgeries very closely after this Mandela Day. So that's a vast number of patients that's actually been operated on by the NGO. But besides the surgeries, we've realized that, it's not just the operation that actually makes a difference in a cancer patient's treatment. So from pamper packs and food parcels and patient support systems, thousands of patients have actually been touched by the NGO and benefited from this attempt in providing more holistic and timely treatment.
This time around, your target was 30 surgeries that would be conducted in a day, but you surpassed that, at least 35. I mean, how on earth were you able to perform 35 surgeries in one day?
A miracle. That's how. No, it was an absolute incredible day. We've had 5 teams that operated at our 5 main hospitals. So that's Groote Schuur, Tygerberg, George, Livingston, Cecilia Makawani, and we've just had the most incredible group of volunteer surgeons, volunteer anesthetists, volunteer patient support groups, students, aspirant specialists that all showed up and really gave their utmost for this day. And at the end of the day, 35 surgeries were done. We could not be prouder. And you may not even know this, but as a bonus today at Groote Schuur Hospital, another additional 5 surgeries were performed. So it wasn't on the same day, but in this week celebrating Mr. Mandela, 40 breast cancer surgeries were actually completed by the NGO in honor of this remarkable man, and to really, just try and celebrate his legacy and remind us all to live that legacy.
And in celebrating his legacy, I mean, you are giving back to many much needed cancer patients in this country. What went into actually involving so many doctors, obviously partnering up with a number of hospitals at the same time to actually convince them to be part of, this Mandela Day, to give those 35, and now you're saying 40 patients, those much needed surgeries?
I stand in awe of the generosity of South Africans every day. The public, there are a lot of really, really sad and disruptive stories about what's happening in the public healthcare sector, and we are all well aware of the problems that there are. But I can testify to the immense character and generosity of some people that work in the public sector. These are all clinicians that deeply care about what happened to their patients and that will do anything to improve the experience and the outcome and the treatment of their patients. So it was actually not a difficult task at all to provide them the opportunity by providing some resources, for providing some consumables, for doing the advocacy work, for them to actually show up and say, we want to do this for the people that we care for. So it is, it leaves one with such optimism and such hope to see people caring this much.
Yeah, a lot of dedication indeed. And one would say, I mean, those who have been beneficiaries this time around for this Mandela Day, how have they received this wonderful news, that they were able to undergo the surgery? Because I understand it may take months or even years when some are on, a list to get a surgery of this nature.
Well, our patients are the most precious people ever. They are so brave. They are so courageous. We learn more from them than we can ever dream to. Sometimes I say we get more from them than what we can ever provide from them, because their bravery and their courage is phenomenal. The thing about breast cancer patients they are the core of a household. Women they are mothers, they are sisters, they are caretakers, and when they are affected by a disease like breast cancer, the ripple effect is tremendous. So helping these women has this immense wave of positivity and a feeling of relief, a feeling of hope, a feeling of gratitude that saturates the whole environment. Not just for the patient, but actually for us that's taking care of them.
Where to from here? I'm sure you've set up yourself a new target. I mean, this year alone, it was 35 to 40 surgeries. From here onwards, I'm sure you're going to set the bar even higher.
Goodness me, yes. No, I mean, if we can do more, we will do more. It's an ongoing challenge. I think the public healthcare sector is in a tough spot at the moment. I mean, we are all very aware of the budget cuts. We are all aware of the massive challenges that we face, but there are some extremely resilient people, hopeful people that's willing to go the extra mile. And yes, our targets hopefully will keep improving. And next year, why not 50? Let's put it out there.
All right. Good luck, Dr. Liana, on your initiative. Thank you so much for your time once again here on SABC News.